I think if you don't have that eye-hand coordination and tinkering and ability to put things together, and in orthopedics, that's what you're doing. You've got to reconstruct a lot of times. You have a broken bone, a forearm, or anything, and it's just in pieces. And you have to think three-dimensionally, how are you going to put this together? And when you're woodworking or putting something together, you're able to see those things and work with the tools, and it's very delicate. And in woodworking, you can make a mistake and throw the piece of wood away, but when you're working on a human being and it's something that's broken and shattered, you've got one shot to get a screw in the right spot and put it together and then get the plate in and reconstruct this. And I think you have to be a tinkerer and to be able to do something like that really well. When you're in medical school and you start to see the other physicians and you're going through all your clerkships, you sort of find and gravitate to the people that are like you. And I was very sports-minded and very mechanical, and so my family is all engineers or woodworkers or tool and die, and so now I'm sports and tool and die. How do you fit all those things together? That's an orthopedic surgeon. We fix things, we put things together, or working with people, and so it all blended together really well with me. I really enjoy it. It's just I wouldn't want to do anything else. So when I see a patient for the first time, and they come to the office, they'll meet my nurse, they'll meet my medical assistant, and we're all try to get to know you more on a personal level. Try to find out really what you're after, what's going on, where's your pain coming from, and solve the solution, and then give you options. And there's either operative or non-operative management, and see what fits best for you, the patient. And I'm not there to dictate what you want to do or how you want to do it, and I'm not there to talk you into surgery. I'm there to just see what I can do to get you better the fastest and get you doing the things you like to do. And that's really what I like to enjoy to do, is getting to know the patient. By having that local feel, you get to know the patients, I think, better. Being the sports physician for the local high schools and standing on the sidelines, you get to know them really well. And then you start having a patients and you're seeing their children, and you get to know the soccer teams. And it's making me really glad I chose the decision to be here, and it makes practicing medicine a lot more fun. My type of practice that I have is general orthopedics, probably with a more sports side to it. I did my training through the Navy, and so in that situation I was able to treat multiple trauma situations, but a lot of younger kids that are 18, 19, 20 years old that have sports injuries, and I was taking care of the retired community. This is all down in Norfolk, Virginia. Before I even started practice, I was on a ship for 2 years as a general medical officer and went all over the world for different situations. But during that time when I wasn't out on the ship, I'd come back and I'd work with my colleagues in the orthopedic department, and then I ran an urgent care center, and when I wasn't too busy there, I was able to come back. And so when I actually started my residency, I already had seen a lot of things and was able to do a lot of things. Sports, total hips, knees, and trauma. Being a general orthopedic surgeon really works well for me, and so I can do a rotator cuff, complex knee ligament reconstructions, wrist arthroscopies, total shoulder, total hip, total knee, with confidence. Definitely will put you back together. I have a motto: you break it, we'll fix it. So go ahead and do it. Have fun. Hi, I'm Dr. Gegenheimer. I'm an orthopedic surgeon, and I practice here at Freighter South.